Oz's history marketing Medicare Advantage plans. So, Mr. Chairman, I'd like now to ask for unanimous consent to enter into the record an investigation by my staff on the Finance Committee into the marketing middlemen that are exploiting Medicare Advantage rules to aggressively push MA plans on seniors.
Without objection.
Mr. Chairman, this is a continuation of our efforts to spotlight healthcare middlemen that, in my view, are leeching off the healthcare system at the expense of taxpayers and seniors. Our investigation found that too many for-profit insurance companies are spending billions of taxpayer dollars on marketing middlemen to drown seniors in calls and mailers. These tactics are designed to pressure them into enrolling in private health plans that might not even cover their preferred doctor or medicines, or that may put up unexpected roadblocks to getting the care they need. Insurance companies and marketing middlemen have orchestrated a complex and complicated system to line the pockets of shareholders by raising costs for seniors and taxpayers and evading oversight and accountability. Given Dr. Oz's history of basically acting as a salesman for Medicare Advantage, putting him in charge of regulating these middlemen is almost like letting the fox guard the proverbial henhouse. The bottom line is that American tax dollars are in too many instances being used for profit insurance companies for shady marketing practices that take advantage of older people. For-profit insurance companies spend 5 times more on marketing and administrative expenses than traditional Medicare, which is, of course, run by the government. If Elon Musk and his cronies at Doge actually cared about targeting waste and fraud, they'd be focused on waste and Medicare Advantage rather than targeting Americans' hard-earned Social Security. We've successfully fought for more consumer protections against predatory MA marketing, and I asked Dr. Oz to pledge not to roll those protections back. He may be open to our concerns on that, and if he's confirmed, I'm going to hold him to that and watchdog this issue spotlighting abuses. But the bottom line, colleagues, is that this is an ability who has shown, a nominee who has shown no ability to or interest in pushing back on the dangerous Trump healthcare agenda. I urge my colleagues to vote no.
Thank you, Senator Wyden. We will now turn to any senator wanting to make a statement. I ask each of you who do choose to make a statement to keep your remarks to 3 minutes or less so we can keep on time for our Social Security nominee. Senator Cantwell, you're next.
Thank you, Mr. Chairman. I'm speaking about this pivotal vote today because I want to be clear about the devastating impacts that Medicaid will have on our constituents that is included in the House Republican budget. While I appreciate Dr. Oz's willingness to consider some interesting and important reforms like PBMs or the basic health plan, he was unwilling to commit to opposing a cut to Medicaid. The math is clear. The proposal from the House budget would require massive cuts to Medicaid. And I appreciate that my Republican Senate colleagues know this, and which is why it's not in their particular proposal, but now we have to fight the negotiations between the House and the Senate and hold our colleagues accountable to protect this important program. I know Dr. Oz won't. He wouldn't commit. He would not say no, and certainly not no to President Trump or Elon Musk or to the House of Representatives. The House committee that oversees Medicaid and Medicare is responsible for funding $880 billion from these cuts. So you can see from this chart, the only real place to get this is, particularly if Medicare is off the table, is from Medicaid. Even if the committee completely eliminated every single other program in the E&C account, it still gives them 1/6 of what they need. So make no mistake, there is no other way to meet this mandate but then to impact Medicaid. My colleagues who are trying to play down this threat or act like there's some other way around it, it's just not so. It's either bad math or bad faith. Anyone who's telling their constituents is just not being honest with them. Last week, I spoke in my state, in Seattle, Spokane, and Tri-Cities about these Medicaid cuts and was joined by physicians, hospital providers, patients who do not want to shoulder this burden. A patient like Gail Halverson from Spokane who was terrified that the system that provided her and her late partner who just passed with affordable health care will no longer be there for them. She told me, quote, "Who's going to pay for the nursing home? That's Medicare or Medicaid. So are we just going to be left to die?" End quote. Harborview, a medical center in Seattle, with the most advanced trauma care in the region, receives 39% of their revenue from Medicaid. The CEO told me that the cut of this magnitude would be existential. So everyone knows that this issue is on the table, and yet we don't have a nominee before us who will say clearly he doesn't plan to cut Medicaid. According to the Congressional Budget Office, Medicaid-related expenditures account for 93% of the non-Medicare spending in the House Energy and Commerce Committee. The lion's share will absolutely have to come from Medicaid. It's time to now get a nominee who would support that. That is not Dr. Oz. So with this tsunami of cuts that we're looking at, I cannot support this nomination. I hope my colleagues will turn it down as well, and I hope our colleagues will join us in a fight to say no cuts to Medicaid. Thank you, Mr. Chairman.
Thank you, Senator Cantwell, and I appreciate your keeping the 3-minute time limit.
Good.
Next is Senator Hassan.
Well, thank you, Mr. Chair and Ranking Member Wyden, for this markup and this opportunity to discuss the serious implications of having Dr. Oz oversee health care for more than 160 million Americans. First of all, Dr. Oz has shown a dangerous willingness to say or do anything that President Trump directs him to do. And during his hearing, Dr. Oz refused to commit to following the law in the event that President Trump directs him to do something illegal. That failure to commit is disqualifying. If confirmed, Dr. Oz would also be tasked with implementing the devastating cuts to Medicaid proposed by congressional Republicans, which could lead to as many as 30,000 children in my state losing their health insurance. Granted, staters want Congress to increase access to health care, not a budget plan that would take health care away from children, seniors in nursing homes, and thousands of people living in rural areas of my state. Dr. Oz is one of several Trump administration nominees that say that they recognize the real difference that Medicaid and other health programs make, and yet they are joining an administration and are supported by congressional Republicans who plan to slash the health coverage and programs that people rely on. In my state, that includes parents that I just met yesterday of a young man with autism whose health care is provided by both Medicaid and Medicare and would not be able to obtain private insurance otherwise. It's also my constituent up in the North Country over the last week expressed her concern that her twins with severe disabilities would also be pushed off of Medicaid, leaving her and her family without access to critical care for them. Finally, I will note that a number of states, including my state of New Hampshire, has something called a trigger law that applies to its Medicaid expansion program. Should the degree of federal funding for Medicaid expansion, which among other things provides critical mental health care and addiction treatment, should that go below 90%, which was the federal commitment for Medicaid expansion, 10 states in this country will automatically lose Medicaid expansion. So the implications here are real, they are serious, and Dr. Oz's assertion that he cares about Medicaid, that he understands how important it is belied by his unwillingness, as Senator Cantwell pointed out, to commit to protecting the Medicaid program and his willingness to join this administration. I urge my colleagues to join me in opposing the confirmation of Dr. Oz. Thank you.
Thank you, Senator Hassan. And Senator Smith and Senator Lujan have agreed to let Senator Warnock go next.
Thank you very much, Mr. Chair. Long before I came to the Senate, I was fighting for my state to expand Medicaid, which would give an estimated 600,000 Georgians access to affordable health care. But here we are, 15 years almost to the day of the Affordable Care Act being signed into law, and still Georgia has not expanded Medicaid. Georgia continues to deny its citizens access to this program that's being supported by the tax-paying Georgians. To make matters worse, now Washington Republicans have proposed to gut almost $900 billion from Medicaid to give millionaires and billionaires an additional tax cut, potentially kicking millions of Americans off of their health care insurance. Medicaid covers almost 40 million children across the country, 2 in 5 children in Georgia, 1 in 10 veterans, 63% of seniors in nursing homes. Medicaid also supports 1/5 of all hospital spending, especially in communities without many hospital options. Washington Republicans and Dr. Oz say they want to make Medicaid more efficient by requiring people who get their health insurance through Medicaid to fill out government paperwork each month to prove that they are working. Here are the facts. Here are the facts. Nearly all adults enrolled in Medicaid are either working, in school, or caregivers. By and large, if they can work, they do work. I know that may be hard to believe in a country that increasingly maligns poor people for being poor, but by and large, these folks are already working, or they're caregivers, or they're students. They are construction workers, they are restaurant servers and mechanics. They're doing exactly what Dr. Oz and Washington Republicans want them to do. But here's the deal, Republicans need a whole lot of money to pay for their tax cuts for the wealthiest among us. And they know if you give people enough bureaucratic hoops to jump through, then enough working people will get tripped up by the red tape and lose their health care. And so that's the plan. Less money spent on a working mom's cancer treatment because she didn't fill out the right form every month by the right deadline, so you have more money for billionaire tax cuts. We know this because I live in Georgia. Georgia is the only state with work reporting requirements in its Medicaid program, and all of this program has to show for itself 5 years later is 6,500 people enrolled. We've got nearly 600,000 Georgians who are in the Medicaid gap. The governor's program has enrolled a whopping 6,500 people. Mr. Chair, I know I'm running out of time, but as I close, and nobody believes a Baptist preacher when he says as I close, let me be really clear that I'm voting against Dr. Oz. I think he is knowledgeable, certainly more knowledgeable than Secretary Kennedy about the program that he's tasked to lead. But we've got to take seriously the needs of millions of Americans who will lose their health care, and so I'm voting no for his nomination, and I urge my colleagues to do the same.
Thank you. Senator Smith.
Thank you, Mr. Chair. Mr. Chair, I'm speaking today in opposition to the nomination of Dr. Oz to be the administrator of CMS. I'm voting no because of what I see as a concerted effort by the Trump administration and some congressional Republicans to use Medicaid as an ATM to pay for tax breaks for the biggest, most successful corporations and wealthy individuals. And at a time when Minnesotans are struggling to afford their lives and President Trump's policies are making it worse, not better, I can't support the nomination of Dr. Oz, who will be an enthusiastic participant in a plan that will make Medicaid health insurance harder to get and more expensive. Now, in my home state of Minnesota, 1.2 million people get their health insurance through Medicaid. These are seniors in nursing homes, moms and their kids, working families, people with disabilities, and patients struggling with mental and behavioral health challenges. Medicaid is the health insurance that covers more than half of nursing home residents in our state, and it covers 1 in 3 Minnesota children. And it is the biggest health insurer for mental and behavioral health care for Minnesotans and Americans. That's 15 million Americans. But here's the reality. Taking away health insurance coverage from people won't cut sickness. People will still need health care. They just won't be able to get it in the most efficient, cost-effective way. They will get it in emergency rooms, not doctors' offices. Taking away health care insurance will hurt people, and that is the most important issue at stake here. But it will also cost more money at the end of the day. Mr. Chair, I was home this past week, and I have heard so many stories about Medicaid and how it saves lives. I want to share one story with the committee. Last week, I met a remarkable young woman. Appropriately, her name is Hope. As a teenager and young adult, Hope suffered from debilitating and life-threatening psychosis. If it weren't for Medicaid, says Hope, I would not be alive today. In Minnesota, Medicaid covers inpatient mental health care. Hope was committed, and she was treated in inpatient care, and she got intensive treatment for her psychosis covered by Medicaid. A diagnosis of psychosis can feel so hopeless, but Hope was able to get intensive care. She needed to learn how to understand and control her illness, and today she is able to live independently and is able to manage her mental health. And today, she gets her health insurance through her employer. So colleagues, I am voting no on Dr. Oz because I do not trust him or this administration to follow the law and to protect our health care. I cannot trust him or this administration to run CMS to protect access to health care for Hope or for the 1.2 million Minnesotans who get their insurance through Medicaid. Thank you, Mr. Chair.
Thank you, Senator Smith. Senator Lujan.
Thank you, Mr. Chairman. Mr. Chairman, recently a mom from New Mexico shared the story of her son who was diagnosed with hemophilia at the age of